So has everybody had a chance to review the minutes?
So moved.
Yep. Second.
Yes. All in favor?
Aye.
Opposed? 18-1, you're up.
18-1 is a resolution to accept funding from the University Emergency Services, Inc. through its Division of Medication for Addiction Treatment and Electronic Referrals, otherwise known as MATTERS program, and it's to purchase a harm reduction vending machine, which will be located, if approved, right outside of Catholic Charities. Has already asked if we would use their location. Their location is a hot spot for people who use substances. I think this is a good opportunity for us, like other programs, to trial to see if these life-saving medications will be used in this area. It's not anything that we're endorsing the use of medications. It is really for life-saving only. Narcan would be the main medication that would be in these vending machines, and you know that Narcan can be picked up at any pharmacy with anyone that requests it. This area in Fulton is a hot spot. We know that from our GIS mapping that there is a lot of overdoses that occur in this area. So it would give people the opportunity, and how it would work is that you use your cell phone, you dial a number, they give you an access code, and they would allow you to get 1 box of Narcan and a fentanyl test strip, if that's what they are seeking, to make sure that the drugs that they're putting on does not have fentanyl. This program also will provide them with treatment options when they are ready to seek treatment, but it gives us the opportunity to save a life or two while we're waiting for them to either get into treatment or decide that treatment is their what they need to do.
Open for discussion.
I make a
I
motion.
make a motion.
Oh, yeah, that's
Second.
I make a motion.
Okay,
Yes.
second.
I think totally this is probably a good idea. Fulton's not the only place we need this. That's neither here nor there. My question is, maybe I just don't misunderstand, or I'm not overly skilled with I can use a flip phone pretty damn good, but besides my Android, I can't. But that's neither here nor there. What the situation is, you're saying they can use their cell phone, they get an access code like that. Well, first of all, the person that needs it's not going to be able to do that.
Right.
And number two, the other people or another person or persons that are trying to get through this, we want to make it simple, stupid, because everybody's going to be so hyped up about, we're losing our best brother or our friend or significant other, or et cetera, et cetera. I want it as simple as possible.
They would have no problem getting access. All they have to do is dial the phone number, explain the situation, that I'm getting this for my brother, he is using, and I want him to be able to carry Narcan and give him a fentanyl test strip so he can, yes.
And how long does that process take?
It's very fast. They walk up to the vending machine, they can dial the number, they get the access code, they can get the medication, any life-saving materials they need, and receive it, go about their business. The agency, it's out of the University of Buffalo, will track all this information and will receive all that information and data back to us. So then we know 6 months, in a year, if more vending machines are needed, if it's working so well that, wow, this is the ideal solution, or temporary solution anyways, and we can use it in other areas, or no one's using it. So then at that point, we can make a decision if we're gonna give the vending machine to Catholic Charities to, this is yours now. sign a contract and just be done with it. The whole thing is that we need the data. And I think the year with the University of Buffalo taking full responsibility with the liability and stocking the machine, I think that's a good opportunity for us.
All right, now let me, and I don't mean to be the devil's advocate here, it's people that have an addiction problem and their friends. That's a whole different mentality. Now, how do we know, is it, first, let me ask, back in this a little bit different. Is this gonna be monitored as far as some kind of video recording or anything like that?
There will be a video.
Because we gotta know if somebody or some person or some group of people are not taking and hoarding their stuff, so they can go out and party up and I'm not picking on Plastic, for God's sakes, but go up to Plastic and party on and have that available, so when one of their friends or relative or whatever overdoses, they can, give them treatment.
I don't think I understand your question.
We don't know if we're not gonna say Susie Smarts isn't coming up there and picking up 10, 15 of these.
They won't allow them, it will allow them exactly what is needed. The University of Buffalo will deliver 1 or 2 Narcans, a fentanyl test strip. They'll have to come back each time. And the same phone number, I can't imagine they're gonna just keep letting the same phone number get so many of the medications.
Okay. But even if they did, that's part of the tracking system.
That is actually part of it.
I mean, that's information I think we have to know.
We get all of it on the reverse stocking.
And you said the county incurs no liabilities for the whole year.
Not for the year, that's correct. The University of Buffalo.
What are the costs after the year? Because there's costs associated with reporting.
So there's no cost for the vending machine. The vending machine will become ours.
Okay.
We will have to stock it with the Narcan, which we are a certified prevention program. They call it a HOOP. So we get Narcan for free anyways, and then if we continue to get the fentanyl test strips, if that is something that is utilized, we would seek funding for that.
It's got in here that there's an annual fees for software, warranty, and cell services.
That's, okay, that is correct, and that's part of the contract. And I would request that through the pharmacy opioid settlement funds. Thank you, Jen. I couldn't think of it, thank you.
You probably already said, all right, but we will get a report throughout the year,
Yes.
not just at the end of the year.
That's correct. Anytime we would like a report, they will give it to us.
Okay, so we could track it and see if it's every quarter or something like that, so we have some idea.
Yes, and they send us the materials, so this agency will also provide us with any materials that's going inside the vending machines for the first year. So we'll know what's being utilized also, but we'll get a more detailed report as we need it.
Oh yeah, just to expand on what Mr. Klein is saying, I guess he's concerned about the security of the location as well. What type of machine is this? I see it's got a cabinet, but is this something that can be easily vandalized?
Well, it will be locked down. It will be chained to the wall, to the cement,
Okay,
and there will be a video camera.
okay, because it says that,
I don't think
it
anybody's
says
gonna,
that you're responsible for it.
Right,
Anything not covered by warranty, and I would doubt that
if
someone took a
someone
sledgehammer to
did,
it.
I would, well, we'd have it on video, and
Sure.
then we
I got you.
We
I
just would not use it anymore, right.
And they can walk down to the pharmacy and get this for nothing anyway,
They
so, right,
can.
so there's really no
They
big
can,
advantage.
it's really a different location where they can get the life-saving material.
Okay. I see it.
I think the advantage is this is 24/7 goes to pharmacy.
That's a good point.
That's
All right. What about it? Okay.
Go ahead.
Although I'm not on this committee, I thought it was important to come today to voice my opposition to this as a whole. I think it's a terrible idea. I think it's a very slippery slope. I do not think that this machine being, if you've been by Catholic Charities, you know what this building looks like now. It's about on its way out. I think it's going to bring even worse activity to Fulton. And there's a pharmacy literally 1 block away, which doesn't address the whole 24 hours thing, but let's focus our energies on treatment. Let's stop enabling these people to keep getting saved again and again and again with no consequences. Part of any drug treatment program is, hitting rock bottom, realizing you need help. This is going to, have them not have to go to a professional services, hospital, doctor's office, nursing, public health, someplace to go where they can actually get help. This is just on the street. I think it's a terrible idea, and I'm really surprised at all the support that it's getting. And I will be voting no if this comes to the floor.
Thank you. Appreciate your comment.
Thank you.
Yes, no, I appreciate, and I do, and I agree a lot what you're saying. It's unfortunate we are where we are. But let's really be honest, look at the whole picture. And I agree with treatment, I agree with prevention, on and on and on. However, the bottom line is, anything we try is something new, and anything that we try might get results, because let's face it, this war on drugs, we have lost. It's a non-winner. We have not made one damn dent in all the time I've been alive, or at least since I was in high school when drugs were just coming in. We have not done anything to curb it. So let's get real. We got to try something. Anything we try, and it's all going to cost money. I don't care how you cut it. You don't think so? Believe me, it's expensive. We got to try something.
Okay. Any other questions? Frank?
Some comments first. One, I applaud the health department for doing what they're doing, which is they're supposed to try to save lives. Okay? And that's what our health department does. Okay? And I'm very proud of that fact. However, it's we can't beat them, so let's join them. It's part of my idea. Okay, and I have talked to a lot of people over the past few days. Okay, and they can't wrap their minds around it either. Okay, it's something that you're asking. Well, it's okay to go ahead and do it, because we're going to be able to give you something to take care of. Back, climate's here, so listen, Jim. Back when we first started carrying Narcan, the sheriff started carrying it, and there was a comment made about why. Okay, and I thought it was appalling at the time, but people make choices in life. And yes, we're supposed to help them get around their choices and make good choices, but I don't think this is it. You made a comment that said that if there are more vending machines required, okay, I don't know any neighborhood in my district or ward in my district that would openly say, yes, I would like one of these in my ward. Okay. Only because what you're doing is you're bringing more in. It's just like the vape shops and the other areas that you're saying, okay, what's starting to happen, because now we're going to bring more people in that are going to use it. But people are going to sit there, so which is, you want people to die? No, I don't want people to die. I want them to do the proper thing. If somebody ODs, okay, somebody's going to possibly, then you have to call the 911. You get the proper people there to take care of it the proper way. And that's what I feel, and that's here. And maybe if a miracle happens between now and the time it goes to the floor, I might change my mind. But I've tried this many times, gone through my head many times, and I just cannot sorry, I cannot say, let's join them and let's help them get fixed so they can do it again. Okay? Now, maybe they won't go back to the vending machine next time, maybe they go someplace else and then they'll come back to the vending machine. Okay? It's just, we have to say, we're gonna keep fighting this. We're not going to enable them. And I hate to go off on a tangent a little bit here, but it's like in the education system. We've got low graduation rates. So what do? We lower the standards so that they can graduate. And now we've got people not getting into college. So what are we going to do? We're going to lower the standards so that they can get into any college free and not have to worry about taking a test or anything. They're going to be able to get into any state school. So we're not helping. We think we are, and all the experts will say we are. And yes, I want to save lives, but I want the lives saved the proper way. I don't want it saved by us saying, okay, now at the end of the year, what is the actual cost going to be? Because I believe we did ask that. What is the actual cost going to be? It's going to be free, but who's paying for that freeness? The taxpayers are, somewhere. It's coming out of our tax dollars somewhere, okay? But yet we're saying we're fighting it. We're not fighting it, okay? We have to do something different, and I applaud you again for trying to save lives, and I will always applaud you for that. But this is not, in my eyes right now, as it stands today, something that I will vote for here, maybe on the floor in a week. I kind of doubt it, because everybody I've talked to so far says, why do we want to do that? I don't want that, I don't want it in my neighborhood, and I don't want it, if you're going to do that, do it for the people that have got diabetes, so that you got something out there for them, to get it free, get taken care of free for diabetes. All these different,
Happy
problems. Okay, so that's all I'm saying. I can't agree with it. I applaud you for what you're doing, trying to do, but I can't get behind it. I'm sorry. Thank you very much. That's it for me.
So Vera and I had quite a conversation over this. A couple things with this. This is a one-year program. At the end of the year, it needs to be reevaluated. She's going to come back to the committee. She's going to have some numbers. She's going to have some data. Do we want to continue with this program? Do we want to pass it over to something else? This is going to happen eventually, whether we're engaged in it and have control, or we're not engaged in it and we don't have control. I'm not talking about putting vending machines on street corners. They're talking about if there's one in Fulton and it works, do we put one in Oswego? Do we put one in another community that's having the same problem? The area around Catholic Charities is already infested with this. It's not like we're picking a place and saying, well, we want to draw everybody out of the other. Will there be people that do this? The other problem with this equation is it's free already. Fentanyl strips are free. Narcan is free. It's about creating a location that if somebody does not have availability to that, either their location or ours or whatever, they have access to this stuff. I'll be honest with you. I didn't like this idea. She knew that. I did not like it. I wasn't even sure we should have this discussion. But it's going to happen. And I'm not going to go off on my part of it, but if you look at the world and the way it's changing, everything is on the table anymore. Everything. There are people ready to sue Target, because they lost $9 billion in value yesterday. Their stockholders are ready to burn the buildings down. The world is reacting different than what we grew up in. My high school had a smoking room, and if you smoked grass in there, nobody said a thing. A lot of high schools didn't have that. Maybe that's why I'm a little weird. I walk through there every now and then and count with. But the risk is to us as an agency to figure this out is very minimal, no liability. We're not paying for supplies. We do want to track it, so there may be some cost in that. We want to know the numbers. And then 1 year, I don't know if it's going to be the first Tuesday of this month, the same day next year, but 1 year, She's gonna come back, and we're gonna have this discussion about what we're doing with this going forward. And I don't know whether you can do quarterly numbers, whatever you want to set up. But again, the other part of this is, it's HIPAA controlled. That video is not going to be something that she's going to come back and say, well, we had 15 females, 10 males, one guy came back 9 times. That's all HIPAA protected under medical. The question for us today is, this is going to happen. If Buffalo University wants to put that machine in this county, it's going to go somewhere. Some nonprofit or somebody is going to say, I want it. They don't need our blessing to do it. This is something we can monitor, we can look at the numbers, we can make a decision. Is this something we want the county involved in? I think it's a no risk 1 year. And if it saves 5 or 6 people's lives, I agree with you completely, Frank. I could care less what you do with drugs. I don't want you to do them around me, I don't want to be around you, but I don't want you to lose your life from it. So.
And it's probably not the person that uses drugs that are going to these vending machines. It's probably the family members that don't want to lose their loved one.
Mark was next.
Yeah, I'm listening to everybody's comments, and I have to say that I agree with everybody's points. I mean, they make significant points, and Richard pointed it out quite clearly. We've lost this battle. I don't even think we've got a fight in the game anymore. It doesn't even seem like we're making much headway at all. And, you know, I don't want to pick on Frank, but somebody with diabetes has a clear mind, right? These people, this is a mental health issue, right? This drug issue, just as bad as, you know, somebody trying to kill themselves, right? They're not thinking clearly, right? So, because if they were, they wouldn't be using drugs, right? I think we can all agree on that. So, I think, Jim, you make a great point. You make an excellent point. What else are we doing? I mean, we got to try something. This is something. It's not hurting anybody. It's not the best answer, but it's something. And for the lack of having an answer from any area of our government, we don't have an answer to this. We're not making any headway. So now we're going to start giving out Narcan. People get Narcan 2-3 times a day. I don't understand why it's not treated the same as we do suicides. I brought this up at our last health. Guy tries to kill himself. We send him over for observation. He's got to talk to somebody. They don't just let him go. You overdose. They give you some Narcan. You can refuse medical attention, and you can go right back out and do it again. So to me, why is the person committing suicide any different than the guy trying to kill himself with drugs? Doesn't make any sense. But we can, like Jim said, if we can save a life, we can save a life.
My only concern is that, and I don't know if this is a good look at it, but for me, it's we're data driven, our society, and all these people coming in, going after this Narcan. Why can't we use that to help fight it? I mean, use the information. Why does it have to be confidential that these people are the same people are using it? If they are, then why can't we track where they're buying, what they're buying, and use it as a tool to fight it? I mean, if we don't use it as a tool to fight it, what's the point of putting it out?
I think they can use the data.
Yeah,
because
but
of
it's
HIPAA,
They do. The video is really for protection and liability of the property.
Right.
The phone numbers is where we're getting the tracking.
Right.
And they're going to continuously get text messages saying these are treatment options in your area, call Farnham. So it's not just the Narcan. With this program, if they buy into it, can go further. And that's the hope, is that eventually they go to treatment and recovery.
Yeah, but most people aren't going to self-report. You almost need an eye watching it, just to make, that's my opinion.
No, I agree.
And if they're getting it for free, why does it become a HIPAA issue? Why does it fall within it?
Well,
it is with the pharmacies too. It's everywhere.
Yeah.
You're correct, but it's everywhere.
Are we certain about this HIPAA thing? Are we 100% sure about this?
I guess my question about the HIPAA protection is, from Vera's statement, it's often not the patient who's picking this up, so why would there be a HIPAA protection when there's being, not that the product is not being supplied directly to the patient? It could be somebody else. Why is that helpful to the patient?
But you don't know who's picking it up.
Right.
You don't know whether that is a patient or a family member. There's no ID.
I question whether or not it's actually covered by HIPAA, but I would
No,
leave that to you.
Right.
I'm pretty sure it is. I lived in the HIPAA world.
Well,
Day
that's
to
your
day.
profession, right, so.
Yeah.
A lot of times we throw HIPAA out there and it doesn't really actually apply.
Mhm.
A lot of times it does.
I don't think that the number of visits and stuff like that, that's not protected. Because that's not, identifying factors back to the person is what has to be protected. That's what HIPAA is. Same as our clients. We can answer a lot of questions for family. There's a lot of stuff we can't. If there's not a release form that says that, I'm sorry, I don't care if you are a mother or father. You can't share that.
But we had one resolution, this was gonna be quick.
It is, but you ready to vote?
Mark, the history of this county is the shorter the health committee's agenda is, the longer the meeting. It's always been
Pretty cool. Well, we knew this would be a discussion. We talked about
Yes.
this. I said, wow, we got one thing. She said, wait till I tell you what it is. Go ahead.
You know, there's been so many things that said just in the past 5 minutes, you know. But, not to beat up that horse here, but the fact is that everybody's talking about it's only for a year. It's only for a year. And everything's free. It's only for a year. And if we don't do it, somebody else is going to do it. But the county is taking it on to say we're going to do it by passing this. Okay, and that kind of says a lot to a lot of people. Some people are going to be very upset that the county is saying okay to it. And I would say more people are going to be upset that the county is saying okay to it than people to say that, well, the county owns it. Well, the county doesn't own it. We do. We're going to say it's okay. And as far as the location, I don't know. You guys know it if you know your geography, okay?
Well,
Where Catholic Family Charities is, okay? The drug use is coming out of Granby. Because Mona knows, no, I'm telling you, the reason I'm saying that is because it's not the city of Fulton, okay? You've got this location in the city of Fulton, but they're coming out of Mona Knolls, which is actually it's on the other side, you
Of the
cross
road.
the street, and it's
yes, the line divides it.
it's right
The
there
road.
in Granby, okay? So you're bringing them in. Now there's not going to be a lot, so we're all going to congregate here or anything like that, but it's the point that you're saying yes to it. It's going to be located in Fulton, but in order for the people down in, let's say if there is a drug problem, because I'm sure there must be a lot of different areas in Fulton, okay? If we talked with the common councilor for that ward, is he all in favor of that coming into his area? Okay, now I believe that's, Mark, that's your district, correct?
Yes.
Yes, it is, okay. So, I mean, it's not my district, okay? But if you get more of them, where else are you gonna put them?
It depends on the hotspots. We do a GIS map that looks at where overdoses are and the frequency of overdoses. This was an area that was highlighted as red, and we reached out to Catholic Charities and they agreed.
Now, I know that from parking in the parking lot that where I park, or, to go to the Ed Center, okay? 3 times this past week, the ambulance has been to a house on the corner. It's in my district, and I know that the person in that ward would say no to anything like this, okay? But if the county says yes to it, then it's gonna go there. And those people are not gonna be hit, especially the people in that area are fighting to try to take their area back, if you're gonna put, something, let's say at the Ed Center, because that's where, where you're gonna want, where you're gonna have the cameras on it and everything else, then that's gonna draw more into that area. Well, it's okay, I wanna go there. It's just like putting feed out for, when you're deer hunting. If you put something out there, they're all gonna come around. And that's what they're gonna say. I'm just telling you, that's the way it looks, and that's the way I feel it's gonna happen. I'm beating the dead horse here because I know that there's only one of us that's gonna probably vote no on this, and it's not I'm voting no on the health department. I'm voting no on this particular issue.
Frank, you're entitled to your
Thank
vote. No one's ever gonna challenge.
Just one last thing, I wish Rich was here because I do not believe that we would not be held liable. They can say all day long that, University of Buffalo is gonna be first in line to be sued, but who's second? If you know anything about litigation, you can sue the first, the second, the third in line, so on and so forth, so. I would like to know.
Can't stop people from suing us, we can only win.
Okay.
Yeah. Or
So-
get it dismissed, or.
You cost us the fight.
I think we've heard this. I just do want to throw one other stat out there for Frank. Most of the shoplifters caught at Walmart are from Fulton, but the stores in Grandview.
They have a Fulton address. Don't They have a Fulton address. Somebody tell me where it says, I live at County Road 6, Granby.
We're gonna put
Okay?
We're gonna
Where
put
does
on
it
the
say that?
police form.
County Road
The
8.
police
I live
forms
in
have
Granby.
addresses
It
of where
says Fulton. 13069 covers a lot of areas. Don't even try to go there with me.
The
I
police
know.
forms
People
have
tell me,
You
don't
ready for a
change
vote?
my city. You don't live here in this city.
Are you ready
Don't
for a
tell
vote?
me.
Yes.
Because
All in
I don't need
favor?
anyone.
All right.
Aye. Opposed? Motion carries. Thank you. She's gonna be doing reporting. I know you've got something you gotta go to. That's fine. Huh?
You don't have to leave.
I'm not recommending it, but
No.
I said she's gonna be doing her report now, so
Oh.
if you've gotta go.
I'll sit
That's
down
the
for a
only
couple minutes.
resolution.
That's important.
Oh, we got a bid?
Oh, I'll stick around for a bit.
I don't have anything here. I got the bid, but I don't have the resolution. Oh, we just got voted on.
Yeah.
Oh, okay. All right, so we need to vote on the bid. There was one person, Lamar Advertising, that returned.
Make the motion.
Second.
All in favor?
All right.
Advertising for what?
All right, any discussion? You open up the discussion.
Open for discussion. Go ahead.
So it's a outdoor advertising billboard that we're looking at. It comes from the COVID enhanced detection grant, and it was a pretty significant amount of money, and we really could only use it for vaccination or mask wearing. So we decided to go vaccination route and stick with the "Thank you for getting vaccinated" sign.
Whoa, lots of people like that.
There's several different locations that we.
I got no problem, but a lot of people ain't going like that.
Although today, the mask might work better.
It would,
It didn't work today.
I've been asthma, and I've been looking for a mask.
I'm having trouble with it, too.
So we're just gonna post signs thanking people for getting vaccinated? Is that?
Yeah, it's like getting us back to normal life and getting the bivalent. The same as the bus ad that we did that said, "Thank you."
So it's a subtle message to
To
continue
get
getting
that.
that.
From the health department, not the county though, right?
From getting vaccinated.
Right.
It is from the health department.
That's the only thing we can use this money for, is this.
From the
Either
health department, I'm okay with it.
vaccinating
That's
or.
their job.
Yes.
Is the same message on all those boards are
Yes,
posted?
yes. So we took out get the bivalent vaccine to bivalent vaccine available. So we took out the get the bivalent vaccine to bivalent vaccine available. And it's just thank you. Thank you for getting vaccinated. SUNY Oswego sent us pictures that we could use for their hockey team. All of it's completely funded through this grant. and it was close to $30,000 that we had to use.
And you can't use it for anything else.
No,
Who provided camp?
Should we spend the money?
that was New York State,
Wanna give it
is it
back
New
to
York
them?
State, Jen?
Nobody else.
COVID
will stay.
enhancement?
Yeah, it's a federal grant, but it's through New York State.
We get inundated on television advertising about this stuff. You talk about peeing money away, that's crazy.
Take a vote.
There's nothing else to do.
Oh, but everyone's asinine. I mean, we're staying, how many counties across the country are getting this kind of money?
Yes.
All money.
There's a better way to spend this money, that's all. I mean, it's not, I know our hands are tied, but man, oh, man, oh, man.
Are we ready to vote?
Vote.
All in favor?
I-
Opposed?
Yeah, I'm opposed on this one too. I'm sorry.
So,
I
Three
can't.
to three.
I'd rather give the money back. What are we doing?
we're gonna be the only ones in the United States trying to give it.
Yeah, but
God
Jimmy,
bless Oswego County.
Make sure you get that out.
Jimmy, how much more advertisement stuff do we need on this?
You got an argument with me, the fundamentals of money, I have no problem with. The money's there, they gotta spend it, or they give it back.
The idea that we need to spend money on stuff, just to spend the money on stuff, otherwise we gotta give it back, I say give it back.
Oh, did you just say, is that recorded?
Yeah,
Is this thing playing?
Yeah.
Because what you just said, is so much around here, well, if we don't spend it, we lose it.
Gentlemen, it doesn't matter,
Okay.
it's defeated.
Yeah, I know, but I'm just saying, a lot of people in this legislative body, I've heard.
If it's important to spend it, then spend it.
Oh.
I don't
It's
understand the
fine,
difference.
it's fine, the motion was defeated.
Yeah.
All right, so that,
On that note, we'll go on.
how was the wording?
Take care. Mark,
Thanks,
have a
Mark.
great day, Mark.
You too, Frank.
Approval expected.
I'll be back.
Sorry.
I wish we could have used it for other vaccines.
Yeah, that's right.
If
It's
we could
crazy.
use it for
Money's
other
there.
vaccines, it would have been
Maybe
nice.
she can find
But
something.
it is COVID vaccine, people are
Okay, but
done
Motion wasn't
pretty
taken.
much.
Many people
What
are-
is that?
We're getting advertisements on the television still. How much more?
There's too many people out there that'll be affected.
Yeah, but it's still my money.
I still hear it.
That's the reality.
Okay, well, clarification, so this is rejecting the bid.
Okay.
You don't have to return money yet if you've got another purpose for that money that can fit within that program.
Right.
If it's not COVID vaccine related or masking, there's no other,
They didn't say that. They rejected the bid for the billboards.
okay.
So if you've got another piece that can fit that agenda, bring it back,
Be creative.
Okay.
okay? That's
Okay.
what was
We'll bring it
rejected.
back to discuss the team.
Nobody said, you gotta go back and start counting the money out, and put it in a box and send it back,
Wait a second.
okay?
Wait a second. See now you just went around the end.
No, we didn't. We were voting on the
You did.
bid.
And Rich caught it, okay? And Mark is gone, so he didn't catch it. But, Rich and I caught it, and I'll speak up and I'll say, look, wait a second. No, we said that we can't see spending money to spend money.
That's part of the discussion. I agree with you completely.
And that's what you, now you're gonna say, okay, well, you know what? They don't want the billboards, they don't want the bid, so let's spend it on something else.
There might be something out there.
There might be
that-
something there. We were
Yeah.
voting
It
on the
might be a
bid.
better fit.
That would qualify.
We voted on the bid. If she has something and her department has something, they can bring it. If you still don't want to spend it, you can turn that down.
It's gotta be COVID related. It has to be COVID related.
Let them figure that
That's their
out.
creative, just like ours.
Yep.
Not your
Put
job.
force mental health. I don't care what you do. What are they gonna do, fire you? We're not gonna fire you, so what the hell?
I can just use it any way I want.
I don't care.
I don't think we've had this exciting of a health meeting in probably 3 years.
Buy a car.
No, we don't
Hey,
want
you bought cars
You already
yesterday.
bought two.
Yeah,
We
let's have
bought
more.
cars yesterday. Let's buy a car to go around and check on people on COVID. There you go.
No, there you go, that's a good point.
Hey, there.
You're up for your reports.
Okay, so I'm pleased to announce Jody Martin is our newly appointed Deputy Director of Public Health. Jody comes to, well, she's been in the county for 16 plus years, worked mostly within the preventive division. She has her master's in nursing with her focus in public health. I am very happy that Jody has accepted this position. Do you want to say anything?
I'm glad that this is a eventful meeting. But I still have a lot to learn, but beer is great, and I do feel confident in a lot of my abilities, but I do have to learn environmental, like a couple different areas, but I'm willing to work and learn it, and I have a great leader, so thank you.
She'll probably tell you, never take vacation when there's a health meeting coming up.
That's okay.
Very good, Jody. Congratulations.
So for communicable disease surveillance, public health emergency order ended at May 11th. Flu is no longer relevant in New York State, which is wonderful. That was a very long flu season that we had, and we're not seeing the numbers have decreased. It did go down, and then it wasn't prevalent, and then it came right back up. It like spiked back up, and now it's back down, and hopefully it's over for this year. We are seeing increased GI communicable cases, which is normal for this time of year, with people doing cookouts and people playing with turtles. We talked about that the other day, which that does happen. Immunizations. We have vaccinated 14 migrant camps so far this year. Our maternal child health program has 14 cases. We have seen an increase in referrals in the last couple of weeks. Hospice, the census is 11. We have 11 bereavement cases that are open, and the last case will be closed in September. So more to come on that. Healthy families. Our census is 25. That's the highest number that program has ever seen. So we're thrilled that we have 25 families enrolled. Public health education programs continue with the schools on vaping and mental health issues. Staff have completed the recertification for the child passenger safety course, and they're attending lots and lots of tabling events. OD2A, which is the overdose to action. We've held 2 public health and safety team meetings. This is where we partner with public safety and our HIDA officer. They have been wonderful meetings. We are moving forward to prevent overdoses within the county. We purchased the last of the funding with the fentanyl testing strips and the xylazine testing strips through this program. This program is slated to end at the end of July or June. Oh, it is August? Okay. So this grant ends at the end of August, so we are trying to use up some of the funding. So the testing strips are what we use some of our money on. We continue to finalize the data use agreement. That's the EMS. We've been offered to a new program where we can receive the EMS data, and the data use agreement on our end has been signed. We're just waiting for New York State and the EMS to tie up their loose ends through New York State Department of Health. Early intervention, we had 39 referrals in the month of May. We still have 174 children that are awaiting services at PT, OT, speech. We just don't have the providers in our county, so that's pretty rough on our staff.
Vera,
Yes,
let's go back to that.
yes, please.
We have people on early intervention that require service,
Yes, that we cannot provide.
and we cannot provide.
That's correct.
And what happens to these people when they don't get it in a timely manner?
They start school not receiving the therapy services that they need. Which we want to do this to them prior to going to school. So, yes, it's very sad to see. And it's not just our county, it's everyone. And some of the counties are hiring PT, OT, speech and we are looking into that. I don't think that's an option for our county because our license does not cover those services. So I don't believe it's an option for our county. But those we have calls into those counties to see how they're doing it and if it's viable for us, because I'm not sure that it is.
So we just let the kids go by the wayside. So
I wish the answer was no, we're not, but we don't really have a choice. Because there's not enough providers. This has been brought to the state, Jim, legislative process.
NISAC
Huge.
every time.
Well, Jim, I'm gonna just stand up with them in 14, 15 years in our jails. And then I gotta feed them. And then I gotta give them health.
Yep.
And then I gotta put them on probation. And then I'm gonna have to house them later on when they shoot and kill somebody.
The state does not fund this to the level it used to be funded at. It's an argument every year. We're gonna have it again this year. Had it in the spring, we'll have it in the fall. We put a resolution to them every time, every year.
You work closely with Tammy to get all the detailed information, and it's still, there was no budge. We're not the only company.
I don't care about the other counties, I care about our county.
I know you do. So, strategic planning and accreditation. Strategic planning, we will be presenting our strategic plan at our next health committee in July. We will have completed our SWOT analysis. Everyone here that filled out the questionnaire that we sent out, thank you very much. Our last one will be at PAC this Thursday, and we'll have all the data we need, and we'll present that to you. Jody has worked very hard on it, and it's a pretty amazing document that she has. And it is a working document. We know as we evolve, the plan will change, and we are prepared to do that. We applied for and got accepted for the readiness and training. That's part one of the accreditation process. We're just waiting for the payment to clear, and then they will start opening up all our trainings that we need to take. We are starting to prepare our staff for the accreditation process and make sure they understand that it is a huge undertaking, but we are moving forward and trying to get everyone excited about it. We do have an accreditation team that is put together. We're going to start meeting bi-weekly. And as we begin the process, and the first meeting is going to take place on June 15th. Environmental updates. Eric, kind of these up. These are kind of...
Oh, these are special.
Yeah, these are kind of neat. Thank you. Oh, I need one. Can't give them all up. Thank you. Our first Super Dirt Week meeting was held on the 23rd last month. Future meetings and dates were planned, and deadlines for submissions were stated at that meeting. So that is like a well-oiled machine. Emily Oldenburg took over when Judy retired, and she really does, it's down to a science what we need to do to get Super Dirt Week off and running. Environmental are going into their busy season, and it's really starting to ramp up. We're starting to see lots of applications for Harbor Fest, many inquiries about new campgrounds and other facilities. Children camps applications are in and ready for review. We did the initial beach sampling, and mosquito surveillance program is underway, and staff is, 2 of them are completed their training, 2 of them that are starting next week will be in training with Dr. Oliver that following week. So everything's underway, and if you want to take a look at this, our epidemiologist Danielle puts this together, and it shows all the public health nuisance complaints that we've had. We had 35 open, we closed 24 of them, and then we had 34 new complaints. Most of them you can see is septic. And then it goes into the facility complaints with the Atupa which is our adolescent tobacco, 6 food service complaints, lead program, they have 70 open lead cases. We have closed 14 of them in environmental, which at one point we weren't sure when to close them, but now we know, and we are starting to close some of those cases. Cooling towers, we're at 64% compliance, which is wonderful. If you remember, we were only at 23 last year, so we've really made lots of headways with cooling towers. Rabies clinic data, Parish was our last clinic where we vaccinated 117, 96 dogs, 21 cats, and to date we've vaccinated 483 animals. You can see the rabies program and our information on that, and if you turn it over, she made this cool little map that shows you what animals have been positive for rabies and animals that we tested that have tested negative, which is 15 so far. We did have one just last week, a positive gray fox in the Alt Farm area. So to date, we have 5 positives. I did inquire about the drop bait, and we're reaching out to the DEC. Usually I get a letter saying these are the dates, and we haven't received it yet. So we are reaching out to say, hey, are you considering doing the drop bait again this year? Hopefully they will. Oswego County.
Yeah, the drop bait is proven to bring these numbers down.
Way down, yes.
Oh, big time.
Mm-hmm.
Big time.
That's all I have.
What is the requirement for bats? If you get a bat in your house and you don't know where it's been or what it did,
You should try to trap it, call us, and we'll test it.
okay. And if
Because
it
if
comes
it-
back positive,
Yes, so if you don't know, we're gonna vaccinate you with, we're gonna recommend it, or have you get treated.
how many shots is that now?
It's 4. Oh, I was gonna say 6. Did it used to be 6? 4.
I mean, even if he didn't get bit, he's gonna get vaccinated?
If he was in the area, because they don't know.
Well, I ain't telling you anything, man.
The survival rate of rabies is like 1%, only 1% in the history of the world.
When I start foaming at the mouth and not wanting water, then, shoot me.
Okay, that you'll want to be
All right.
shot.
I don't know how you guys start carrying guns now.
Question, not related to this, but with what we've been having with the air
Yes.
quality, do we put out an alert to people?
So we are working on something. I talked to Diane today. I started getting phone calls with children playing sports, and if they can be out and about, it really should be limited time outside. And then if they have any respiratory issues, asthma, they should be wearing a mask if they are outside for any extended time. It is supposed to get worse tonight.
Yes.
Is there any way you can get to the schools, because they're taking their kids out nowadays just to get them out of school because they're getting ready to, they're finishing up the year. And there's kids out playing tennis out there at the middle school this morning. I was like, I can't believe how bad it is out, and they're all out here running around.
Yeah, it was actually shocking for all of us to go outside today.
But we don't have no control on that school.
No, I don't say we do, but we
We
should at
don't,
least
but
be
we
able to
can
alert the
put up
public.
the
Like go to the
information.
schools and say, hey, you might want to keep them inside today.
Right, and what they choose to do. I mean, that's
Right,
up
then
to
it's
them.
up to them.
But to put out the information, very young and very old should take caution being outside.
They've
Use
been pushing it
air,
on television,
Mhm.
advertising the devil out of that.
air humidifiers. I have Diane reaching out to some of those neighboring counties to see if they're putting out press releases, but we need to put out
We
some.
do something.
So I want to give a comment that Board of Health, and I'm going to detail here that past period, a year or two, if this comes up, the health department did their raids on smoke shops with extremely good success. Absolutely amazing. The issue they run into is they all know each other, so by the time they got 4 or 5 of them done,
Yes.
the other ones, they went and their lights were out, the doors were closed and locked during business hours, so they've got to go back and re-scoop a few, but you'd be very, very proud of them, believe me. I was amazed at some of the results.
I've been sitting here trying to think of how to make lemonade out of lemons. And listening to the committee's objections to the bid, correct me if I'm wrong, it's more the message that was going to go on the billboards that was the problem, and not necessarily using billboards as public health advertising. If that is so, perhaps we could check to see, under the restrictions of that grant, could we alter the message to something like have a happy, healthy year and use it to promote counties or physicians' immunization programs and clinics, where COVID is simply listed among 4 or 5 others. Your flu shot, your pneumonia shot, your rabies shot, pets. Visit www for more information on immunizations for a healthy year. Some type of message like that, where COVID is mentioned, but isn't the focus of the message. Would that be an allowable use, and how does the committee feel about that, using billboards to promote immunizations in general?
Oh, yeah, I like that.
Yeah, go ahead.
That's something that
You voted
we
in
can,
favor of it. Absolutely. So your comment is no.
that's something we can definitely look into and verify. I don't think it will fly. This funding is actually part of that, though you might remember that extra $1 million we got for mask or vaccine mandate funds. So to date, they've been very specific that it needs to be COVID vaccine or masking, but
Try
we can ask.
the argument that the other immunizations prevent comorbidities.
Okay,
Make it COVID worse.
yeah, doesn't hurt to ask. Worst they're gonna say is no.
And if this keeps up, you can spend $29,000 on masks and give to the public.
It's for advertising.
Well, we could do a budget amount and move it to 5 masks if they would allow us. At this point, I'm not
The reason
sure.
I'm bringing it up now is if that's a possibility, the committee, while it's still meeting, could do a motion to reconsider that vote, and then table the bid decision until we have an answer on the advertising consent. And that way we don't waste this bid process.
And I
And
think,
Holly could ask the vendor to hold their bid
right.
while we do this.
And we do have another grant that is specifically a COVID vaccination grant that does allow the funding to be used for regular vaccines also. And that does have some advertising money in it. So I think either way, we could probably use this bid for one of those 2 pots of money.
So it might be worthwhile to save the bid, because
Yes,
the objection is the message, not that we're doing
yes.
all right out there. So it's up to the committee if you want to leave that option open.
Well, can we, until she has that information, can we table it?
Well, we
Well,
gotta
that's what I'm
bring it back.
suggesting. We do a motion to reconsider the bid. It's got to be made by somebody who voted against the bid.
Frank.
And then you,
Oh.
then you move it again. Somebody, or does a motion to table it. And that way we can tell Holly to ask the vendor to hold their bid for 30 days while we make a decision.
Well, I'd make that motion that we.
Yeah, you voted for it. Don't you think we forgot?
The
You
person
think
that-
I'm getting that senile?
If you want to reconsider a vote,
You want to
it has
reconsider a
to,
vote?
it has to be made by somebody who was on the prevailing side of the vote.
Where's Mark? Mark just walked by.
But you still have 5 members here, so.
Yeah, we have enough
You
to
voted
vote,
against, you can
but
resend it.
the 2 of us,
We're not,
one
Frank.
of the 2 of us, and I'm
There's
saying
something
no.
right.
I'm not
Okay,
gonna, not gonna bring it
that's
back.
fine. And if you choose that, that's fine. You're
Mike
entitled.
can say that he wants to bring it back.
I want to see the whole plan before
You're not gonna see the plan unless we rescind the vote, though, because there is no plan.
Right, because the vote earlier was to reject the bid.
We're rejecting the bid. What we're doing is, if we rescind it, then it holds the bid, and then they can come up with another plan. And we still have the
Without having to
bid.
go out to bid again.
We won't have to put it out to bid a second time. We already have a bid. We're not approving the bid, we're just holding it.
Yeah, I want to see what you guys come up with.
Okay, cool.
Okay.
Thank you.
I have a motion. Do I have a second?
Second.
Second. All in favor?
Aye.
That's a motion to reconsider.
Reconsider.
Right, so now what you need is a motion to table the bid.
Yeah, I voted against it.
Frank voted against it.
Yeah,
But there's 4 for it, so it passes.
I know.
So now I need a motion to reconsider.
Table the bid.
Table the bid.
So many.
Second.
All in favor?
Aye.
Opposed? Thank you.
Thank you, Ben.
Yeah.
One thing-
Sure. I got questions. Yeah,
We have no answers, so we can't.
I got questions.
Have I ever stopped you from talking?
Yesterday, when I was speaking with one of the other legislators from the North Country, they're saying that there are marijuana shops opening up in the North Country in different villages. So, are we aware of anything like that? Because as far as I know, there's only been 2 state licensed marijuana sales. That's what he's saying, that there's some up in the North Country.
I'm not aware of that.
Okay, but when we do, we find out if they're legal or not. I know that. I know because from what Jim said.
And the health
You gotta
department
check
does not do any enforcement on
No,
marijuana.
So that would be, you let the sheriff's department or the local town code enforcement.
all right.
Yeah, kind of the process, and you did a good job with the one that tried to pull it off. You got, let the right people know and they shut it down immediately.
Second, nurses. How are you on nurses?
We are short on nurses.
How many are you short?
Do you have a number?
Careful how you answer, because he's going to use this for his next article.
Right now, we have 1 bachelor prepared position open, 1 RN, and a part-time RN. And we just changed over our 1 nurse to a senior health program specialist.
Right,
So
so
we're-
we're one LPN.
And 1 LPN, so we're short 4.
I'm quick at adding that. Now, this is a loaded question here. Salaries for the hospice nurses, was that higher than the salaries for the regular nurses?
Yes,
Okay. Now, the salaries for the nurses at the jail, was that higher than the salaries for the regular nurses?
I believe so, but that's not, I do not have any, the jail I'm not really familiar with. I believe it was, because I think we based the hospice salaries off the jail nurses' salaries.
The reason I'm bringing that up is because it's been said numerous times that we can't pay nurses that were in jail higher than the other nurses because the union won't let us. And also, it's the
No,
same-
No,
That's not true, because
No.
it's called registered jail public safety.
Okay, I'm just saying,
Registered nurse
I'm just saying what was said
Okay.
in the meeting yesterday. That we can't, and it happened to us in hospice also. So what I'm saying is that it's there. It may not be what we want, but the reason I asked you is because you're the expert on the salaries for the nurses that are working for you and that did work for you in hospice.
Hospice.
And that's why I asked.
Yes, we reclassed those titles.
Okay, that's why I asked you. You were the expert on that.
Right,
Okay.
and there were new titles for the sheriff, or the jail nurses as well. We attempted to do that to get a higher, to attract more. It didn't work, I still could only get LPs.
Got my answers, that's, I'm glad. And I just think that we do a great job, you do a great job, the health department. Sorry that I had to vote against you today, but I can't always say yes. Thank you very much. I'll make the motion.
Second.
All in favor?
You just passed the whole COVID signs again.
No, I didn't. We just,
We were-
no, I didn't.
Frank.
We just said adjourn. I said, I'll make a
No, we
motion.
didn't say.
Mine said yes. Second.
Yes, we are.